Hi everyone, this is Dr. Karamachi. I go by Dr. K. I wanted to quickly talk about health insurance and how it is impacted by COVID. What has happened over the last 2 to 3 months is because the doctors have stopped doing elective procedures, like they have stopped doing knee replacements, hip replacements, heart surgeries, joint surgeries, all types of procedures that were scheduled, they were all canceled. And because these procedures were canceled, the health insurance companies were saving a lot of money. And what is expected is next year for the premiums, they expect the premiums to go up anywhere from 4% to 40%. So we are not sure where that number is going to be. This is with the assumption that you're still employed and you have an employer-based insurance. Now, if you're unemployed, then there are several options. People who are under the poverty line, they can apply for Medicaid, and people who are above the poverty line, they still have Obamacare plans available, which they can go online and sign up at any time. Some, I think, will also get disability benefit, and Medicaid is part of that. It depends on each state, so you can check into that. I partner with several companies that do health insurance planning. If you need advice about that, you can send me a DM, and I can point towards the right person to talk to about. So it's going to be really interesting. One of the numbers that were thrown out in news is there's a company in California that did some number crunching on how much it costs to take care for COVID-19, and they came up with the result that a patient with COVID-19 can bill as much as 70 grand. That's the overall hospital bill. That's with the prediction that they'll stay in the hospital or the ICU for at least 12 days, and they'll need a high level of care. So if this is going to continue, if more patients with COVID-19 need care in the future, then chances are the health insurance companies have to pay more. And there's also the question of whether they'll cover COVID-19 or not. We are hoping that they'll cover. So, and if they do cover, then they'll be paying more in terms of reimbursement for the claims. So, to recuperate that money, they may charge more money next year in terms of premiums. So it's very interesting how the math is going to play out. But the reason why I'm going over these numbers is, a lot of people, they want the care, they are going to the hospital, and eventually they may get a sticker shock. So I just don't want you to be in that position where, you get a huge bill once you go through the care in the hospital and the ER and so forth. And the best way to prevent that from happening is to have a healthy body, so that you can invest your time and your money and effort right now, so that you prevent becoming sick, and you don't have to go into the ER, and you don't have to go into the hospital or in the ICU, and you don't need this expensive care. So if you spend $500 now, it will prevent a bill for $50,000 in the future. So this math is so lopsided that most of the times when I talk about these numbers, like a lot of my patients, they cannot grasp these numbers. They really don't want to spend money for preventive care because they really don't see the value downstream. And the value downstream is you save thousands of dollars, sometimes millions of dollars in care in the future. And this goes beyond COVID-19. Like, if you're diagnosed with COVID-19 once, it can impact what your life insurance is going to be 10 years down the line. It can impact, whether you can get a job. A lot of people don't know these things, and these are going to play out in the next 5 to 10 years. So it's very important that you make sure that you don't get COVID-19, so that you don't face these consequences in the future. I'm not trying to scare, but this is something that is factored in. The insurance companies have figured out this game so well that they have the best minds working for them. So it's usually a rigged game where they do the math ahead of time, and they get the maximum benefit. So it's very important to invest in your health, whether it is taking supplements or exercising or nutrition, keeping a healthy mind, doing all these things so that you don't get sucked into this this situation where you have to get expensive care. So that's briefly about health insurance, COVID-19, and more. If you want me to talk more about these things, if you want me to talk more at length, comment below. Also, if you want me to reach privately, then send me a DM. I'm always available. Thank you, Candy. Thank you for Dana for listening to me. I look forward to talking to you again. Have a wonderful day.